flat there, okay? Good.
Put your hands down at your side.
Hold your breath. Breathe. A little bit, okay, sir? I'm sorry. I know that's the side that hurts.
We did a chest x-ray, a thoracic x-ray, lumbar x-ray, pelvis x-ray, and a left rib x-ray. They're sent from this screen to a computer that goes directly to our radiologist who's upstairs reading now. And as he reads them, they go through the computer and are eliminated in order of how he gets them. And they're read immediately.
With the x-rays complete, Don is now on his way for a CT scan. Computed tomography, sometimes called CAT scan, uses special x-ray and computer technology to obtain detailed cross-section images of the body. With their high-resolution, CT scans can clearly show even very small bones, as well as surrounding tissues such as muscle and blood vessels.
It's going to be pretty bumpy, okay? All right, do you take anything by the name of Coumadin or Plavix or anything? Any type of blood thinners? No? Okay. You hold real still, sir, okay? We're going to be doing CTs of his head, his neck, and his abdomen and pelvis. Looking for any type of bleeding or fractures.
In Don's case, the images appear to reveal a suspected pelvic fracture. Thanks to the latest technology, Dr. Clark will have the results of those tests momentarily. Unlike most people who come in by helicopter, Don's injuries do not appear to be life-threatening. But for those who are severely injured, Memorial's Level 1 trauma team is always ready.
Let's get his clothes off. Someone get some blood work on.
Get the thruster on, please. Get laps.
The 17-member team of medical specialists converge on the trauma bay within seconds. They quickly assess the patient and begin treating the most life-threatening injuries first, working together as a well-coordinated, exceptionally talented team.
Good for football.
Okay. Your belly hurting at all? We're at.
Okay, have you got blood work yet? Stop on that. Get the blood work, please. Get it from the groin. Do we have readings yet? 80 over 40, pulse is 140.
Yes, we give him some fluid.
Someone set up the level 1, please. Go ahead and give him like 500 cc bolus. It looks like he's got some blood there. All right, let's get him ready. Get him packaged to go upstairs.
And many times the teamwork begins far outside of these walls, with the dedicated men and women who volunteer their time with local ambulance and fire companies. Here's Helene Gleason with their story.
Thanks, Amy. Just like the trauma specialists who stand ready 24 hours a day here in Memorial's ER, there are hundreds of other caregivers throughout the area who have dedicated their lives to bringing emergency care straight to your door, day or night.
Our role is to respond to emergencies, illness and injury, to treat patients in the pre-hospital setting.
Well, we understand that, but you have to get some help to make this better.
EMS is basically the front line for the emergency department at the hospital. We provide the care when somebody calls. We're basically like a mobile ER. We're the eyes and ears of the doctor at the ER prior to our arrival there.
Chest pains, illnesses associated with diabetes, with strokes, with high blood pressure, and cardiac is a big portion of the calls that we receive.
These are exceptional people who help strangers in distress. But every once in a while, it's not a stranger who's in distress, it's a friend.
I was just sitting there, sweating, and I think the only thing I could think of was I knew I was in trouble.
59-year-old Fran Uris has dedicated his life to saving other people's lives. As a 24-year veteran of the West End Ambulance Service, he spent countless hours helping those in need. But on September 9, 2004, a medical scenario unfolded that Fran and his colleagues never could have anticipated.
And I was bringing boxes from the attic down to the first floor. And I was home by myself at the time, and I started developing what I thought was gas pain. So after a few minutes, I went down, took a Gas X or something like that, and went back to doing what I was doing. And it still stayed there. And then all of a sudden I noticed I was sweating very heavily.
Fran was suffering from a heart attack, something, despite all of his training, he couldn't comprehend.
When I said call the ambulance, I can remember just kind of like just sitting there, and there was nothing going through my mind. I was just sitting there, sweating, and I think the only thing I could think of was I knew I was in trouble. But at that time, I still did not admit that I was having a heart attack. I didn't know what it was, but I still didn't think it was a heart attack.
Fran, what's going on today?
I don't know. Until the ambulance crew got there, I still did not want to admit that I was having a heart attack. And I didn't admit to it until I heard what my blood pressure was. Then I knew I was having one.
Put some stickies on here, okay?
Okay, I know what that's all about.
The ambulance staff with Fran's co-workers arrived in minutes, equipped to help stabilize Fran, whose blood pressure had plummeted to a dangerous 60/0.
They were talking back and forth to the doctor, and thanks to having the 12-lead EKG from the DART unit there, they were able to determine that I had a major blockage in one of my coronary arteries.
We can look at the electrocardiogram. If we see evidence of an acute myocardial infarction or heart attack, we can actually mobilize the cardiac cath team as soon as we get that electrocardiogram.
They got me into one of the cubicles right away, got me on a monitor. Dr. Wainert was there. He told me what was going on with me. He said, we're going to get you into a cath. Believe it or not, by 2 o'clock, I felt fine. It was like a new guy.
Fran returned to work shortly after his scare, and life returned to normal. But having been on both the giving and receiving end of ambulance services, Fran realizes that if it weren't for his skilled colleagues, the outcome could have been devastating.
So, by calling the ambulance, there's no doubt in my mind, it saved me. Had I told my wife or a neighbor or something to take me, I might not be here right now. So don't ever hesitate to call an ambulance. You're never going to get complaints or yelled at for calling us because it wasn't that serious. We'd rather come for that than having to call the coroner when we get there.
The EMTs we spoke with for this story wanted to let you know that there are things you can do at home to make it easier and quicker for emergency personnel to get into your home and begin providing care. Here's their advice.
The lights and sirens we use are asking for courtesy or respect for us if they would move to the right of the road to allow us to proceed through.
It's important that your house is well marked with your house number so that we can find you as quickly as possible. It will always be helpful, especially in the evening, to turn your porch light on.
But if they could keep a clear pathway into their home for us, that would help us considerably.
And if you could have a list of medications that you regularly take.
A list in their purse available to us to have those medications or all the pertinent information we need to treat them and also give the hospital upon our arrival. That would help us immensely.
The Conemaugh Health System has a form like this you can fill out with emergency contact information, medication, and allergy information. It's good to stick it somewhere handy in your home, like on your refrigerator, or put it in your wallet. For a copy, you can call our Nurse Connection or download it online at our website, www.conemaugh.org. Be prepared for an emergency.
Thanks, Helene. Speaking of the Conemaugh Nurse Connection, it's a number you ought to write down and keep handy.
Hello, Conemaugh Nurse Connection. This is Candy, registered nurse. How may I help you?
The Conemaugh Nurse Connection began in October of 1995, and in that time, registered nurses have fielded over 1 million calls. Like the cases seen in the ER, the calls to the Conemaugh Nurse Connection vary greatly in both type of patient, newborns through the elderly, and in severity.
When patients call, we have a approved set of protocols we use to triage their symptoms, and that way we can tell them if they need to go to the emergency room, visit their doctor, or sometimes we can just give them some tips that they can use at home so they don't have to visit the emergency room or their physician.
Calls to the Conemaugh Nurse Connection are free of charge, and the staff is there 24 hours a day, 7 days a week.